Okay guys, I think suddenly the recording stopped. So we are discussing about dependence and alcohol withdrawal, right? So some of the things that which we most commonly see in those things is craving, the control is lost in the patient, tolerance also decreases, withdrawal is seen, salience and knowledge of harmful use is also observed in the patient. Now we also see some condition called reverse tolerance. What is meant by reverse tolerance? What is meant by reverse tolerance? It's also known as sensitization or hypersensitization Now there we can also see some sort of genetic vulnerability. What is meant by that? Even a small dose, a little dose of substance induce psychosis. Can you tell me one of the example? It's cocaine, simple cocaine. Okay, now we will discuss something about alcohol withdrawal, right? Alcohol withdrawal. Okay. If you notify it, there will be two forms, that is simple withdrawal and complex withdrawal. Simple withdrawal and complex withdrawal. Simple withdrawal seen within 12 to 24 hours. Complex withdrawal seen within 48 hours. And you also observe seizures. Which type of seizures? GTCS. GTCS means general tonic clonic seizures. And clusters of seizures. Okay. Now what are the features that we observe here? First one is tremors. We see tremors in simple withdrawal. Also we see tachycardia. And there will be increased sweating. And there will be something called insomnia. That means sleeplessness, decreased in sleep. And you also complain of night tremors. The patient also complained of night tremors. Previously we discussed night tremors are seen in most commonly in who? Adolescents or young age group. Okay, and there will be a rebound REM phenomenon, rapid eye movement phenomenon. Alcohol REM suppressant. Alcohol is a REM suppressant, remember. And what happens is, if you stop alcohol, on stopping alcohol, what happens is there will be rebound REM. Now this is what the MCQ is in INICT, star mark. If you stop the alcohol, there will be a rebound REM, because alcohol is a REM suppressant. It suppresses the rapid eye movement sleep. But if you stop the alcohol suddenly, there will be a rebound REM. Okay. Now what are the features of complex withdrawal? So within 72 hours, we observe some condition called delirium tremens. Very important, highly Neet PG question. This delirium tremens is a Neet PG question. Remember, delirium tremens, okay, and you can observe there are prominent visual hallucinations. The patient suffer with prominent visual hallucinations. This is very important. Okay, and one more thing is the patient also have Lilliputian hallucinations. Lilliputian hallucinations. What happens is, what is meant by Lilliputian hallucination? See, the name itself denotes seeing all objects appear small. All objects appear small. Seeing all objects are small. Now, one more thing is, these people obviously suffer with altered sensorium because it's a complex withdrawal. It's not a simple, it's complex withdrawal. So, they suffer with altered sensorium. And also, these patients also have tremors. Okay. Now, these are the features of alcohol, simple withdrawal and complex withdrawal. Okay. These are the features. You please study these features because it is a INICET topic. Okay. Now we will get on to one hell of an important thing, that is, can anyone? Treatment. Okay. What is the drug of choice? Right. Drug of choice is benzodiazepines. Okay, and one more thing is, it is safe in liver dysfunction. And one more thing is, you can simply remember with the mnemonic LOT. Why I have written LOT? Can anyone tell what is meant by LOT? Lorazepam, oxazepam, temazepam. These are the three drugs: lorazepam, oxazepam and temazepam. Next, what do you mean by alcohol related psychosis? Alcohol related psychosis. So, something called, you heard it previously, that is delirium tremens. What type of seizures that you see in complex withdrawal? GTCS, general tonic clonic seizures or clusters of seizures. So the patient suffered with delirium tremens and alcoholic hallucinosis, something called alcoholic hallucinosis, right here, hallucinosis. So what are the features of this alcoholic hallucinosis? So this occurs in clear sensorium. Okay, and you can also observe auditory hallucinations are seen in these patients. Okay, and this is the common thing that most of the patients complain of. They experience with auditory hallucinations. Okay, and one more important thing is with the different types of psychosis conditions. These all are: one is delirium tremens, two is alcoholic hallucinosis, and there is another one, that is 3, that is Korsakoff psychosis. Very important, guys. This is a INICET as well as Neet PG important topic, Korsakoff psychosis. Even in pharmacology also you get this Korsakoff psychosis. In medicine is also you get Korsakoff psychosis. You simply remember with the name CCA. Okay. Now what is meant by that CCA? It is chronic, it is confabulation oriented or confabulation is seen means the patient simply tries to filling of gaps in memory, that is called confabulation. That is confabulation. Now another one is anterograde amnesia. So there are actually two types of amnesia, anterograde amnesia and retrograde amnesia, right? So these anterograde, retrograde, they differ according to the feature. For example, in Alzheimer's it's one type of amnesia. In Korsakoff psychosis you see anterograde amnesia. Now can you tell me what is the treatment? Anyone? We will discuss in medicine as well as in pharmacology also. Now what are the areas affected in Korsakoff psychosis? What are the areas affected in Korsakoff psychosis? One is mammillary nuclei. Second one is anterior thalamic nuclei. ఎందుకంటే ఆప్టిక్ నర్వ్ ఎప్పుడు so anterior thalamic nuclei and mammillary thalamic nuclei, right? So these are the areas affected in Korsakoff psychosis. Now that is what all about so called psychosis related things, and we will discuss something about very important Wernicke's encephalopathy. Wernicke's encephalopathy. Wernicke's encephalopathy. You can remember with the mnemonic Goa. Not that Goa you see the beautiful beaches, no, not that Goa, this is another Goa. Wernicke's encephalopathy is an acute emergency condition. Remember, it's an acute emergency condition. So you just remember this emergency condition, and you also see petechial hemorrhages. Wait. Petechial hemorrhages in mammillary lobes. And also you also observe, see mammillary lobes, we also observe these things in right here, periaqueductal gray matter areas. Okay, gray matter areas. I will just acute emergency condition and this petechial hemorrhages are seen in the address. Now previously we written something with the mnemonic called Goa. Now G for global confusion. You can observe that the patient has a global confusion, and O for ophthalmoplegia, and A for simple ataxia, Now we will discuss some drugs regarding all these conditions, which are called aversive drugs. First one is disulfiram. Right? Now what is disulfiram? It is an irreversible aldehyde dehydrogenase inhibitor. It is an irreversible aldehyde dehydrogenase inhibitor. Very important, disulfiram. You might get question in Neet PG on disulfiram. Now what it does is it increases the levels of serotonin, dopamine, histamine, and aldehydes. Okay, So this disulfiram increases the levels of serotonin, dopamine, histamine and aldehydes. Now one more thing is, if this disulfiram is taken with alcohol, what happens? It simply causes something called sulfiram like reaction. Sorry, not sulfiram like reaction. Wait. It simply causes disulfiram ethanol reaction. Yes, you can just make it this way. Disulfiram. Yes, you can go on with like this. Disulfiram ethanol reaction. Disulfiram ethanol reaction. Now one more thing is, it should be given 12 to 24 hours after stopping alcohol. Okay, now it is indicated only for patients who are willing to quit. This is important, guys. This is important. You just mark this statement as particular as it is and have good motivation. This is very important. Okay, are willing to quit, and they should have a good motivation. That is important, right? Without this, you can't just simply keep this drug in normal individuals, right? Okay, now one more thing is, I think this statement also needs a bold underline. It should be avoided in peripheral neuropathy. I will just mark it with red color. In peripheral neuropathy, this is very much important. Peripheral neuropathy. And also one more condition. Can anyone guess in which condition this is absolutely contraindicated or avoided? It is psychosis. So in peripheral neuropathy and psychosis, the disulfiram is avoided. Now what about anti-craving drugs for alcohol cessation? The first drug that you see is a compressate. Second one is naltrexone. Can anyone tell what is the drug of choice for opioid poisoning? Naloxone is given as IV. Remember, it's the drug of choice. Topiramate. Next, SSRIs, selective serotonin reuptake inhibitors. Next, ondansetron, 5-HT3 antagonist. Ondansetron is a anti-emetic. Baclofen is a, can anyone, neuromuscular relaxant. Baclofen. Okay. Now these are all the anti-craving drugs for alcohol cessation. Yes, even ondansetron can be used. SSRIs can be used for alcohol cessation. Topiramate can be used. Topiramate actually is a anti-epileptic. It is an anti-epileptic. Vigabatrin, topiramate, lamotrigine, these all are anti-epileptic, neuro-anti-epileptics. Okay. Now, what are the anti-craving drugs for nicotine cessation? That is tobacco. Indirectly we are speaking about tobacco. Nicotine cessation. Now starting with, I will write with red again, varenicline. Sorry. Varenicline, which is a, see, this one is important. Varenicline is a alpha 4 beta 2 partial agonist. So many people write agonist. No, it is partial agonist. I think we discussed pharmacology. Now we will just integrate in the graph regarding the action, right? Dose response. Can you tell me agonist, antagonist and partial agonist? Anyone? Anyone? So this is agonist, this is partial agonist. Now this yellow antagonist, and this is inverse agonist. So this is 1 agonist, this is 0 to 1 partial agonist, this is 0 antagonist, and this is -1 inverse agonist. Okay, so like this you have to just focus, you have to just integrate each and everything you can at time to time, then only you can easily solve the integrated questions. Without integration you cannot do anything. Now for smoking cessation, varenicline, which is the best drug, the best drug is varenicline. Okay, now what is the condition in which varenicline is avoided? It is avoided in neuropsychiatric symptoms. Which what is meant by that? What is meant by neuropsychiatric symptoms? Something like suicidal ideas. If the patient has suicidal ideas, or if the patient is in severe depression, something like etc. These all are neuropsychiatric illnesses. So first one is varenicline. Is there any other anti-craving drug for nicotine cessation? There is one more thing, guys, that is bupropion. Bupropion is a anti-craving drug, and buprenorphine is a drug used for anginas. Okay, so bupropion is a anti-craving drug. Now we will just drop it here. We will just do another session and we will end it. I think there is opioid, there is personality disorders, clusters of personality disorders, mind and defense mechanisms, list of therapies and their uses, and important concepts in doctor-patient relationship, mental health care. I think still there are. Okay, no problem, we'll finish it. We'll finish it as fast as we can. We'll stop right here. We'll just drop it. Okay. Yes, thank you, your wise doctor. Thank you.